Hello. Things people don't know about caesarean section. CS is not a death sentence. Neither is caesarean section a taboo. Caesarean section is a surgical removal of the fetus. That means they will put an opening, they will create an opening in your abdomen in order to bring out your baby, your fetus. And there are certain reasons why caesarean section is done. They don't just section anyone. So CS is not, I repeat, is not a taboo. Most people have lots of misconception about CS, which is wrong. Although there are some misconceptions, today I want to clear the air about those misconceptions about caesarean section. Why do we do CS? Why is CS done to a woman? The rationale for caesarean section is 1. To save the life of the mother. 2. To give birth to an healthy infant. No, pregnancy is not just about giving birth to a baby, but we're talking about giving birth to an healthy child. When I mean healthy, that means a child that can do the normal thing, that the normal developmental milestone takes place normally. Not that a child is at 6 months, he cannot lift his head, he cannot lift his neck, because you feel that CS is bad. No, CS is not bad. So let's talk about reasons why caesarean section is done. The first reason for caesarean section is 1. Maternal distress. When I mean maternal distress, a lot of women, they go into labor trying to give birth the normal way through the vaginal canal, but due to certain things they get stressed out, they feel exhausted, and they don't have enough strength to push down their child. So if you are a doctor and you see a woman, she's worn out, she's exhausted, she does not have strength, will you still allow that woman to go through the normal process of labor? If you allow such to happen, that woman might lose her life, the baby might lose her life. So what is your aim? So the first indication for caesarean section is maternal distress. So let's go to the second reason. Number 2, fetal distress. When they talk about fetal distress, that means you're talking about the baby. As the mother is having frequent uterine contraction, the contraction comes, it stops, it comes, it stops, and nothing is done about it. The oxygen supply to the child is cut off. And if you pose that child to much risk, the child might die inside the womb. And nobody wants to experience such. The child might die inside the womb. And the mother will now, maybe after going through normal vaginal delivery, she will now give birth to a fresh stillbirth. So that's the second reason why caesarean section is indicated for most people. Number 3, what's the third reason for caesarean section? The third reason for caesarean section is malpresentation, malposition. When I mean malpresentation, the baby, normally the way God created, the normal mechanism God creates everyone is that the head is supposed to come down first. The baby is supposed to come down through the head. But in some cases, the baby, instead of the baby to descend through the head, the baby is coming with different parts of the body. Maybe there's a footling bridge, it's coming with his leg, or it's coming with the bum, it's coming with both hands. So those are malpresentation. And you don't want to go and risk that. Some people will say, yes, there's a native woman in my community that can take this delivery effectively. But do you know that you are posing that baby at risk? If you try to manipulate, you might affect the skull of the baby. You might affect any part of the baby's vital organ, and the baby will now be lagging behind when it's developing. Things he's supposed to do at the normal age, you can't see such children doing it because of the stress they undergo during what? Delivery. Hope you're following what I'm saying. So that's the third reason. I don't want this video to be too long, so we'll be stopping here. We're stopping at 5 minutes. If you want to learn more, I'll be dropping another video shortly. Watch the part 2 of the reason why caesarean section should not be seen as a taboo or a misconception. So let's stop the video here. If you want to learn more about this particular topic, or if you have any contribution that you want to add to this discussion, kindly leave a voice message or you drop a message. If today is your first time of joining AG's World, do well to follow us. We normally give tips on health, we do some adult entertainment and lots more. Please, if you have anything about CLD part 2, we'll continue the part 2 because we've not touched anything and time is running out. We've not touched anything, so I'll be dropping the part 2 of the reason for cesarean section by midnight. If you like this video, click on the like button. If you benefited, share to your loved ones so that they too can clear their misconception about cesarean section. If you've gotten to this stage, God bless you. Keep supporting us, keep encouraging us. We love you. Peace out. Thank you.